I knew there was a lot of people like in my corner praying for me.
John Smith's complete recovery has doctors baffled and his family calling it the answer to their prayers. Dr. Kent Suter says it wasn't until John's mother entered the trauma room and started praying loudly that his heart started beating for the first time in 45 minutes. Other vital signs were incompatible with life.
I remember his temperature was 88 degrees whenever we first checked it. And in my mind, this is a very grim, very poor chance at survival.
But not only did John survive, his brain function is normal.
The only factors really that medically were in John's favor is that this was a cold water drowning.
It's a question many ask. Did the cold water of Lake St. Louis play a role in what many call a miracle? Dr. Garrett says yes and no. Chilling the body can preserve brain function in patients with, say, certain heart problems, but
this really shouldn't have worked in John's case.
That's because the lake water was only 40 degrees, and while John's body temperature plunged to 88 degrees, it wasn't done in a controlled setting.
Usually they'd like it to be colder, and you'd like the victim to be smaller, actually. Because what you really need to have happen is for the brain to get cold before the blood flow stops to the brain. So for John's brain to have gotten cold, to be protected from the lack of blood flow and the lack of oxygen, really is a miracle in itself, if that's what medically did anything here.